This is breaking news from the Las Vegas Review-Journal, sponsored by Michael Gaughan's South Point Hotel, Casino, and Spa.
Today, we are joined by Councilman Scott Black, who is the chair of the Southern Nevada District Board of Health, and also Clark County Commissioner and Board of Health member Marilyn Kirkpatrick, as well as Dr. Love, who is our Chief Medical Officer, and Dr. Lockett, who is our Director of Disease Surveillance and Control. Today, I need to leave earlier because I have a conflict with another meeting, but I wanted to make sure that we have at least a few minutes to reiterate my recommendations regarding the mask mandate in Nevada that, as you know, was already lifted earlier this week or last week. As you will hear during our briefing, and as you see each day in our dashboard, the disease metrics of COVID in our community keep decreasing at a very fast speed. This is good news, and it is encouraging to our community, but still we want to encourage everyone to continue to use all tools they have available to protect themselves and others. In the meantime, we also want to emphasize that even so, the number of cases in our community and the positivity rate are trending down. Still, the level of transmission of COVID in Clark County is considered high. Therefore, even so, the mask mandate is no longer in effect. It's very important that when we are in public places, especially indoor, to use a mask, especially those who are unvaccinated or are suffering from immune depressive condition that put them a higher risk for COVID. I will now ask Councilman Scott Black, who is the chair of our board, to say a few words for us. Thank you.
Thank you, Dr. Logan, and thank you all for joining us today. You know, I'm sure we're all beyond ready to get back to normal, but when you consider the fact that we're literally entering the third year of this pandemic, that target might seem still out of reach or almost unimaginable. I was reflecting over the last 2 years about how many amazing ways our community has come together to support each other during these incredibly trying times. And it's been very difficult, but it's also been inspiring just to think of all the work and dedication that has gone into this effort. Many issues still are present that would spark disagreement. I think, though, the vast majority of folks really want what's best for themselves, for their family, and for their community, and are by and large willing to do everything that they can, even still into this beginning of the third year, to do their very best to keep themselves and others safe. I would encourage everyone to be respectful to one another as we still all strive to do our part to put the pandemic behind us. From a public health perspective, like Dr. Logan mentioned, we have measures in place that are proven to work to help stop the spread and to keep people well. And we're certainly encouraging everyone to follow those recommendations and just to be smart with the things that you do to make sure that you stay safe. I wanted to take a moment to say thank you to all those individuals that made the Texas Station vaccine and testing clinic such a success. It was really valuable for us in our community during the holidays and as Omicron reached its peak. So many hands and many individuals and hours of effort went into that to serve our community when we needed it the most. So I'd like to say thank you. That's really just a testament to the partnerships that have come into fruition during this pandemic. I want to personally, as a city councilman from North Las Vegas, thank our North Las Vegas team for all that they've done, and also our partners at Clark County, the state, and all the agencies that have made their best effort to help us during the pandemic. Marilyn Kirkpatrick's here today. I'm super thankful that she joined us for this press briefing. She may or may not have much to say, but I just wanted to say that I'm sure she, of anyone, will appreciate the fact that we're going into the beginning of the third year of the pandemic. She has literally been in the driver's seat in many respects as we have dealt with this pandemic, and has had many, many sleepless nights trying to figure out what we can do to navigate through this. And so I'm thankful for her. And at this time, I'll turn the few moments, if she'd like to say something, over to Commissioner Kirkpatrick.
Thank you, Councilman Black. And I really don't have anything to offer except just to remind people that we're not quite at the end of this, and we have to do our part to make sure that we can continue to move forward. And it's very heartwarming to see people making their choices out there, and so many are choosing to use the tools that we put in place. And, lastly, I think that, and I hope that, folks on this call will stop and recognize the firefighters who are tireless throughout this whole process, our public health workers, the health district who stood up. And I hope that story gets told, because we're an amazing community, to your point, Councilman, but we're not done, and we want to make sure that we can continue to manage it and continue to decline. And I think it's important for us to all recognize people are tired. We've been doing this a long time, and help us help you to not have to talk about this in the near future for a very long time. So thank you for inviting me back today.
We'll now turn the time over to Dr. Loaf to continue our press briefing before we go to questions. Thank you, Marilyn.
All right, thank you. Good afternoon, everybody. I'm Dr. Court Loaf. I'm the Chief Medical Officer here at the Southern Nevada Health District. I first like to provide some updates related to the COVID-19 vaccination. First of all, there continues to be a plentiful supply of the vaccine available at our health district clinics, as well as a number of different community-based clinics. The vaccine continues to be available to anyone 5 years of age and older, with booster doses available to anyone 12 years of age and older. Now, as of yesterday, there have been a total of 3,399,905 doses of vaccine administered in the county, and more than 71% of our residents have initiated vaccination, and about 57% have completed vaccination. Now, as you may have heard, the FDA has postponed its advisory committee meeting to consider granting authorization for the use of the Pfizer vaccine in children 6 months through 4 years of age. Pfizer has requested more time to evaluate additional data about the effectiveness of a third dose. Now, children in this younger age group are the only age group left in the U.S. that are not eligible to receive a vaccine. Now, until they are eligible to be vaccinated, the best way to protect them is to ensure everyone around them is up to date on their vaccinations. One last note about vaccinations. The CDC has recently updated some of its vaccination recommendations for those who are moderately to severely immunocompromised. I wanted to briefly highlight those changes now. Now, those who are moderately to severely immunocompromised are recommended to receive one of the 2 mRNA vaccines if they can. They should receive a total of 4 doses of one of these 2 vaccines, 2 primary doses, an additional or third dose, as well as a booster dose. The booster dose should now be given at least 3 months instead of 5 months after receipt of the third dose. Now, for those who received a first dose with the Johnson & Johnson vaccine, they should receive an additional dose as well as a booster dose of this same vaccine, or one of the mRNA vaccines, for a total of 3 doses. Next, I'd like to provide some updates related to COVID-19 treatment. We at the Health District are continuing to offer antiviral medications for free to treat certain patients with COVID-19. In addition to Paxlovid, patients who meet the criteria for treatment now also have access to a second drug called molnupiravir. Now, both medications are available here at the Health District's 280 South Decatur Boulevard Public Health Center. These medications are available to those aged 65 years of age and older, as well as to those ages 12 to 64 years of age who are at risk for severe illness. Now, it's important to note that people must test positive for COVID-19 and must have had symptoms of COVID-19 within the last 5 days in order for them to receive treatment. Now, people can either come to the Health District's Public Health Center here, again, at 280 South Decatur, to be evaluated and provided with the treatment if treatment is indicated, or they can speak to their healthcare provider who can evaluate them. And if the provider determines that treatment is indicated, the provider can prepare a prescription, which can be filled here at our 280 South Decatur Public Health Center. Again, the treatments are free. We are not offering monoclonal antibodies at our clinic, but there are several sites around the valley that are offering this treatment. We would encourage people to go to the Nevada Health Response website to find locations for such treatment. That's all I have. I'll now turn it over to Dr. Lockett for his update.
Yeah, thank you, Dr. Loaf, and good afternoon, everyone. I'm Dr. Cassius Lockett, Director of the Division of Disease Surveillance and Control. Currently, Omicron is still the primary variant identified in the samples that we are sequencing. However, we are beginning to see more cases of the BA.2 subvariant. Therefore, it is expected that we would identify more cases of the variant in our community. And it underscores the importance of people getting fully vaccinated and boosted, as well as getting tested or taking the self-test if you are sick, and following recommended isolation and quarantine guidance. Today, we are reporting 485,406 cases of COVID-19 in Clark County, an increase of 306 cases since yesterday, as well as 7,286 deaths, an increase of 19 deaths since yesterday. As our case counts drop, I feel it's important to point out that while we will continue to monitor and report our case counts, they are not the single most important indicator that is going to tell us what's going on with the pandemic. It has always been more important to focus on trends rather than our specific numbers. And as the self-tests become more accessible, more and more positive cases will go unreported. However, indicators such as our positivity rate, hospitalizations, and deaths continue to provide a good indication of the level of disease circulating in our community and the impact. On January the 30th, the 7-day average for cases was 1,366.3, which is a 78.5% reduction compared to the 294.3 7-day case average reported on February the 12th. Summarizing the cases per day between February 6th and February the 12th, the case rate per 100,000 is approximately 88.8, which is within the substantial transmission range, which is between 50 to 99.9. And that means we're averaging about 330 cases a day. Although we have shifted between high and substantial transmission, we would like to see the cases and the case rate fall below 50, which would place us in the moderate transmission range. To move to the moderate transmission category, we will need our 7-day average case count to fall below 164 cases a day. If we sum this average over a 7-day period, our case rate per 100,000 will be less than the CDC recommended 49 cases per 100,000 to move us into the moderate transmission category. Likewise, if our 7-day average case count falls below 33 cases a day, and if we sum over a 7-day period, our case rate will be less than the CDC recommended 10 cases per 100,000 to move us into the low transmission range. Our 7-day test positivity rate on January the 30th was 24.9%, which is a 50% reduction compared to the 12.3% 7-day test positivity rate reported on February the 12th. On February the 14th, the 7-day test positivity rate fell to 11.2%, which is still well within the high transmission range. To move to the substantial tier, the test positivity rate should be between 8 and 9.9%, moderate tier between 5 to 7.9%, and low tier needs to be less than the CDC recommended 5%. Meanwhile, operations at our surge testing site at Texas Station will end on February the 20th. The site has administered more than 15,300 tests and served as a vital resource during the peak demand for testing. Once the site closes, our community testing sites will continue to operate throughout the Valley. I encourage people who are testing to visit our website or the Nevada Health Response website to find a location near them. Thank you. I will now turn it back over to Corey for questions.
Thank you, Dr. Lockett. At this point, we will open it up for questions. One question from each member of the media, please. If you'd like to ask something, please raise your hand. The raise hand feature is at the bottom of the participants list, but if you're calling in, please press *9. When we call on you, we will unmute you and then ask you to please give us your name and your media outlet. Our first question today comes from Jonah. I'm unmuting you now.
Thanks. This is Jonah from the RJ. I wanted to ask about the testing sites, obviously closing down the Sam Boyd one, which is the biggest one, and the other ones. What sort of went into that decision? And does it have to do with testing demand or just the overall metrics?
Dr. Lockett?
Yeah, so we definitely track all of the testing metrics from all of our sites on a daily basis, and we saw that testing demand went down by 50% in a short period. As fast as the virus went up, it started coming down, and demand also went down. So we looked at our cases as well, and our test positivity rate to factor all of these things in. And so it's also a matter of trying to spare resources.
Well, and I think this is Marilyn. I think it's also too important to remind folks that there is many home tests that are available. So you could order them from the federal government, the state and the health district purchase many that are given out at many entities. So testing options, or there are plenty out there. And so that's important, right? In the beginning, ironically, when the pandemic started, testing was an issue. As we saw the Omicron, testing became an issue again. So we really are just trying to keep our resources healthy and able, and knowing that there's all of those other tools out there. I think it's important for people to know that you can go to 175 locations to be tested outside of the drive-thrus, that you have home testing. You could get for free via the website from the federal government, or they are available at many locations. And I think that is that played a major factor into knowing when we could back those down.
Our next question is from Denise. I'm unmuting you now. Denise, if you're there, you are unmuted. Are you there, Denise? We'll try her again in a minute. Our next question is from Christian. I'm unmuting you now.
Hey there, good afternoon. Hopefully you guys can hear me. My question is, I know that you guys were giving out some great numbers here in terms of vaccination and the percentage of folks that are vaccinated here in Southern Nevada, but is there any data, anything that shows which communities are still kind of pushing back on getting vaccinated?
Dr. Love, you want to comment on that?
Yeah, I can start on that. So yeah, so obviously we're not really where we want to be in regards to our vaccination rates. As I said, about only 60% of our population have fully completed vaccination. So we really have a ways to go yet to improve those vaccination rates. Obviously, those rates are going to improve once the vaccine for the children under age 5 becomes available. So that's going to be a good thing. But we still recognize that there are certain individuals and pockets of our community that continue to be resistant to or hesitant to get the vaccination. So, and that cuts across lots of different socioeconomic groups across the valley. So We are, though, obviously monitoring those who do get the vaccine, and we're able to look at where our gaps are, and we're using that data to sort of drive our continued vaccination efforts by making sure that we have vaccines, offering vaccines in those communities that not only are great at risk for disease, but also have the lower vaccination rate. So we're keeping an eye on the data, and we're using that data to drive our further efforts with that.
Our next question today is from Jaclyn. Please identify yourself and your media outlet when we unmute you now.
Hi, folks. Jaclyn with Fox 5. Apologies if this was already asked. Zoom booted me out for a few minutes. Did the mask mandate get lifted too soon? And are we concerned about another surge of cases? And when could we see that surge, spike, more cases, if this could happen?
So this is Cassius. I'll start. The only thing I'd like to say is first, masks are still required for hospitals, for transportation, and nursing homes. We know that. We also know that case rates, hospitalizations, and deaths continue to drop in the United States almost as fast as they rose, and I mentioned that earlier. And now CDC is even considering, as of today, easing mask guidance based upon science. For now, 97% of U.S. counties still remain at substantial or high transmission across the United States. And once metrics are better, everyone else may end up getting a break by CDC by, taking off masks, but also being prepared to put masks back on if things worsen. Locally, we are really fortunate. As Dr. Logan mentioned, cases continue to plummet. Hospitalizations, deaths continue to drop dramatically. And we've also noticed recently, as of February the 7th, that concentrations in school wastewater have also shown declines in SARS-CoV-2. Regardless, the most important thing to do is to get vaccinated, especially if you have underlying health conditions or immunocompromised. But right now, we all know that there is still a group that's vulnerable, and that's because there's not a licensed vaccine for 2 to 4-year-olds. So my suggestion would be for that group to surround that child around people who are potentially vaccinated, maybe even if they can tolerate it, upgrade from a single layer kind of cloth type mask to more of an N95, and then reduce indoor exposure while community transmission is high or substantial.
Okay, our next question today comes from, sorry, I don't know who you are, but when I unmute you, please identify yourself and your media outlet. So the name is dayeon. I'm unmuting you now.
Hi, my name is Dayeon. I'm from the Nevada Independent. Sorry, my background is pretty loud, so I'm going to post my question on the chat.
Okay, the question is, following Jaclyn's question, were there any pushbacks from the community since the mask mandate was lifted?
Dr. Lockett, I don't want to speak for you, but I think that, at least what I'm hearing, boots on the ground with the community, is many people are still choosing to wear it. When I drop my granddaughter off at school, many kids still have it on. So I think it's whatever their comfort level is. So I haven't seen any real pushback, but I have seen people decide what's in their best interest.
Yeah, and I kind of use my children as a barometer, having 2 children in Clark County School District, middle and elementary school. And it's been actually, my concern has been around the governor's comments around making sure we exercise kindness and respect one another's decisions. And, that's what I anticipated and expected to play out in the schools. And my children definitely has made me and informed me that, whether it's 8 out of 20 students wearing a mask or half the classroom, so far everybody's been really kind and respectful towards one another. And we really need to make sure we try and optimize that moving forward. and respect each other's independent decisions.
If any member of the media has not yet asked a question but wants to, please raise your hand at this time. We will first go to Mary for a new question, and then we'll quickly do a follow-up from Jonah and Jaclyn. Go ahead, Mary.
Good afternoon. So just to be clear, no one on your panel here takes issue with the decision to have lifted the mask mandate.
Again, I think as shocking as cases went up quickly, and we're all overwhelmed, and we had over 6,600 cases, much higher, tripling any surge we've ever had before. We also saw a sustained rapid decline. And so lifting the mandate during that time, like I said again, still allows for masks being required in hospitals, transportation, and nursing homes. Meanwhile, just in terms of schools, we are working on mitigation plans with Clark County School District, private schools, and charter schools to make sure, again, we are trying to collaborate on the best ways and under what conditions masking may be useful as a mitigation measure, another layer of protection for children, especially, again, as we mentioned on this call, children who yet there is no licensed vaccine or between the ages of 2 and 4 as a recommended layer of protection. Also, we have to remember in the school district, it's, a reflection of what society also looks like. And so there's children who have chronic disease conditions that have to be taken into consideration, children with special needs who have durable medical equipment, and a lot of children who actually travel on buses. And so we're working on those mitigation plans as well. And we were very delighted that the governor, made that part of the plan.
At this time, we'll go to a couple of quick follow-up questions. Jonah, I'm unmuting you now.
Thanks. This is for Dr. Lockett. In looking at the numbers, as obviously you've talked about, the case rate and positivity rate are starting to drop really quickly. It looks like the moving average of daily deaths has not dropped at the same rate, and it's still higher relative to those numbers. Is that just to be expected because we know that that follows other metrics, or is there a level of concern there?
No, we don't. There's no level of concern right now. We have seen the 7-day average for deaths drop significantly as well over time. And so, that's to be expected. A lag is to be expected. And, we were all, of course, concerned because there's not one variant that does not cause death amongst immunocompromised, and especially if you're over the age of 65 with a chronic disease condition. And so those are the at-risk populations, the most vulnerable populations we've been monitoring. And so we'll continue to watch those statistics very carefully. But the best thing to do is really to get vaccinated. The vaccine is highly effective and, again, really proven to shrink your risk of being hospitalized or dying.
Thank you, sir. We will move along to Jaclyn's follow-up question. Hold on.
Hi again. How do we prepare for the next surge? Whether it be monoclonal antibodies, whether it be testing, when if there was a situation like Omicron again, how do we prepare for that?
Yeah, this is Dr. Loaf. I guess I can start. I can address that response first, and then I can ask others to join in as needed. So certainly getting the vaccine is probably the most important thing. As I said before, we still have a long way to go to get additional folks to be fully vaccinated. and not only with the primary vaccination series, but also with the boosters. So we really need to encourage people to do that. Second thing with the vaccine, again, hopefully soon we'll be able to have a vaccine that's available for kids who are 6 months to 4 years of age, and that's obviously going to increase protection of that age group, as well as improve our herd immunity within the full community. And the third, you mentioned about some of the treatment options available. So again, we not only have treatment options available through pill forms as well as through monoclonal antibody infusions, but we also have monoclonal antibody infusion that's available for people at greatest risk for severe complications and death, including folks who are cancer patients and so forth. So, and that particular monoclonal antibody can be used as a prevention. So it actually provides protection from infection in these folks, in addition, as a way to supplement the vaccine's response. So again, certain high risk groups, we obviously continue them to get vaccinated, but in some cases the vaccine may not work 100% in these particular groups. So we would encourage them to seek out the monoclonal antibody prevention as a way to supplement that prevention.
And this is Cassius. I'll just add to that. I think that we're more prepared, as Dr. Loaf has been describing, than ever before. We all now are familiar with what non-pharmaceutical interventions are and how important they are, from masking to social distancing. You know, the whole society is now been sort of marinated on those activities. And then in terms of herd immunity, I think we're in a different place, as now we've seen 3-4 variants and probably can count on more to come. We can't predict the future. We can only look at the current state right now. But in terms of therapeutics and things of that nature, that puts us in a much better situation if they're starting to increase in supply. The supply chain is improving, and learnings and the science is evolving on how we could best utilize the therapeutics. And then in terms of the virus, eventually, there's no, at this point there's not an end to the endemic at this point in time. However, I think now that's one of the next steps, is we need to start preparing how to live with the virus. And what that means is things like the non-pharmaceutical interventions, using your own judgment, and then also robust testing is going to be a part of the strategy moving forward to learn how to live with it.
Well, and I think it's important, Dr. Loff and Dr. Lockett, I think that you are very modest. What people should recognize in, sitting on a national committee and talking to people around the country, we have a phenomenal blueprint where we can turn at the switch and pivot if we need to. Chief Steinbach has been phenomenal during this whole process with the emergency management. So we have a lot to be proud of, and we're in a comfortable space where we can continue to remind folks the benefits of getting the vaccine, where we can continue to remind them of the treatment that's available, the testing that's currently out there. And in worst case scenario, if we ever have to stand something up, we have a roadmap, we know what works, that we can turn on very quickly. So I think that we're in a better spot than a lot of other places. And that is because we have worked tirelessly the last couple of years to make sure that we had infrastructure needs in place. So I feel pretty comfortable that we have all the right people in Southern Nevada, that we've beat so many odds of what they told us would happen, and we've been able to stay one step ahead of it. And that's because we have a phenomenal emergency management team. The public health response and the coordination between all of us allows us to navigate anything that we could see in the future.
At this time, we have no more raised hands, so we will be, hold on, I just got a question in the chat. Let me see. Okay, this is a question from Dr. McKnight, who's a local allergist and immunologist in Henderson. The UK is currently seeing an increased number of COVID-19 BA.2 Omicron cases. Over the course of this pandemic, we seem to be following UK by 4 to 8 weeks. Are we routinely sequencing positive PCR positive cases to identify BA1, BA2, and Delta variants?
Yeah, after this, I have a conflict that started at 1 o'clock. I apologize. I'm going to have to jump off after answering this question. I have a major issue I have to deal with. But I'll just start and I'll just say that, yes, Denmark and UK are usually bellwether stations for the United States and what's happening. And we are sequencing enough to pick up BA1 and BA.2. And I can just tell you that right now, BA.2 has increased from looking at wastewater samples, comparing January the 31st to February the 7th. We've gone to about 3% of what's been of genomes and wastewater to about 15% currently. And so if we continue on that trajectory, by the end of February, we could very well see that BA.2, known as stealth Omicron, would be the dominant, or could be the dominant variant circulating in Southern Nevada. What that means, we don't know yet. We do know that BA.2 is about 40% more transmissible than BA.1, the original strand. And so what does that mean? Does that mean that's going to increase significantly if it becomes dominant? The number of cases like it did in Denmark, that's one scenario that could play out. Or are we just going to see an extension of the cases in the moderate to substantial or high transmission range for a longer period of time? So we don't know the answer to that yet, but we're sequencing enough to be able to monitor that effectively.
Thank you, Dr. Lockett, and thank you for everyone who was on the panel today. Thank you, Chief Steinbeck and Chief Samuels, for joining us. We appreciate you being here, and all of our other members of staff, our subject matter experts who are here today. Thank you. If anyone on the panel has anything you want to add, please feel free to go forth and do that at this time, because we have no further questions. And if no one has any closing words, that will wrap up today's media brief.
You've been watching breaking news from the Las Vegas Review-Journal, sponsored by Michael Gaughan's South Point Hotel, Casino, and Spa.